Feeling under the weather and not sure if you're battling a pesky cold or the flu from the depths of misery? It is like choosing between a mild inconvenience and a full-blown life crisis. Grab your tissues and buckle up because we are diving into the sniffles showdown you did not ask for, but definitely need. Number 10. They both make you miserable, but in different ways. Let's be real. Whether it is the common cold or the flu, both will make you feel like a human disaster. But there are subtle differences in how they deliver their misery. Colds usually sneak up on you slowly with a scratchy throat and sneezing fits. It is like a bad guest who overstays their welcome, but does not cause too much trouble. The flu, on the other hand, is that wrecking ball crashing through your door. One minute you are fine, and the next, you are hit with fever, chills, and a level of fatigue that makes getting out of bed feel like climbing Everest. While both can make you wish you had stockpiled more soup, the flu tends to be much more intense and quick in its attack. Number 9. Symptoms. A case of spot the difference. Sometimes feel like playing a frustrating game of medical spot the difference. The common cold comes with a runny nose, sneezing, and a sore throat. It is that mild headache and general feeling of blah that lets you know you have lost the game of jur roulette. The flu, however, is a more intense opponent. It ups the ante with high fever, severe body aches, and a headache that feels like it is drilling into your skull. One telltale sign: if you are able to go about your day with some discomfort, it is likely a cold. If you are lying in bed contemplating your life choices, it is probably the flu. Number 8. Contagion Level. Who is the bigger party crasher? Both the cold and flu love to crash the party, but the flu is the real scene stealer. It spreads like wildfire, especially in the winter months. It is so contagious that if someone sneezes within a mile of you, it feels like you are already doomed. Colds are still contagious, but not as aggressively. You can catch a cold from touching contaminated surfaces like door handles and then touching your face, which means the cold virus is more like a stealthy ninja. The flu, on the other hand, can spread simply by being near someone who breathes too heavily in your direction. Either way, frequent hand washing and avoiding close contact with sick individuals are your best defense. Number 7. Duration. The unwelcome house guests. When you are dealing with these illnesses, knowing how long you are going to feel like a hot mess is key. A cold is usually a short-term nuisance hanging around for about a week. You might feel stuffy and annoyed, but you can see the light at the end of the tissue box. The flu, however, likes to set up camp. Symptoms can last from 1 to 2 weeks, and even after they leave, they often leave behind a parting gift of fatigue that lingers for days or even weeks. It is like that friend who visits and then refuses to leave even after all the food is gone. Number 6. Treatments. A tale of two remedies. When it comes to treatment, both the cold and the flu have their own set of remedies, but neither has a magical cure. For the common cold, it is all about managing symptoms. Over-the-counter medications like decongestants, cough suppressants, and pain relievers can help ease the suffering. Add in some hot tea, honey, and an excessive amount of tissues, and you have got yourself a care plan. The flu, however, may require more serious intervention. Prescription antiviral medications like oseltamivir can help if taken within the first 48 hours of symptoms. And let us not forget the all-important bed rest. Both conditions benefit from plenty of fluids, but with the flu, you might find yourself bargaining with the universe for relief. Number 5. Complications. When things go south. While the common cold is generally mild and self-limiting, it can occasionally lead to complications like sinusitis or an ear infection, especially in children. It's like a prank that goes too far, but is usually harmless in the end. However, when left unchecked, these complications can require medical intervention, such as antibiotics for a bacterial sinus infection. The flu, on the other hand, can turn into a serious issue, especially for vulnerable populations like the elderly, young children, and those with compromised immune systems. Complications can include pneumonia, bronchitis, and worsening of chronic medical conditions. In severe cases, the flu can lead to hospitalization or even death, particularly if it triggers severe respiratory distress. It is not messing around, which is why getting the flu vaccine each year is highly recommended to protect both individuals and the community at large. Number 4. Prevention, the art of dodging germs. You cannot live in a bubble, but you can take steps to reduce your chances of getting either of these viral menaces. For the common cold, frequent hand washing is your best line of defense. Avoid touching your face, especially your nose, mouth, and eyes, since that is how the virus gains entry into your body. For the flu, an annual flu vaccine is your best bet. It is not foolproof, but it can significantly reduce your risk of getting the flu or at least lessen its severity. Both colds and the flu spread through droplets, so cover your mouth when you cough or sneeze and encourage others to do the same. And of course, if you are sick, stay home to avoid spreading your germs to others. Number 3. Flu shots, the superhero of preventive care. If the flu were a comic book villain, the flu shot would be the superhero swooping in to save the day. The flu vaccine does not just protect you, it also helps protect the community by reducing the overall spread of the virus. Each year, the vaccine is updated to match the strains that are most likely to circulate. While it is not a guarantee that you will avoid the flu altogether, it is your best shot, pun intended, at minimizing your risk. And do not worry, you cannot catch the flu from the vaccine. It is made from an activated virus, so the worst you might experience is a sore arm or a slight fever. Number 2. Home remedies. Your grandma was onto something. If you are more of a natural remedy person, then you are in luck. Plenty of home remedies can help alleviate symptoms of both the common cold and the flu. For colds, drinking warm fluids like tea or broth can soothe a sore throat, while steam inhalation can help clear nasal congestion. Honey is a natural cough suppressant, and gargling with salt water can ease throat pain. For the flu, rest is crucial. The flu will take a lot out of you, so listen to your body and take it easy. Herbal teas, warm baths, and even chicken soup can offer some comfort. Remember though, while these remedies can make you feel better, they are not a substitute for medical treatment if you need it. Number 1. The final verdict. Know your enemy. The bottom line is that while both the common cold and the flu are respiratory illnesses caused by viruses, they are not the same. Knowing the differences can help you manage your symptoms better and seek appropriate care when necessary. The cold is the annoying little brother of the flu, irritating but generally harmless. The flu is more like the troublesome cousin who comes to town and wreaks havoc. By understanding the key differences and taking preventive measures, you can hopefully keep both at bay. And remember, when in doubt, consult a healthcare professional to get the right diagnosis and treatment plan. Because whether it is a cold or the flu, no one likes feeling like a walking germ factory. Now that you are armed to fight off the sniffles like a pro, do not let this knowledge go to waste. Hit like and subscribe, because catching colds is optional, but catching our next video is a must.